Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we are going to be talking about tooth splinting or periodontal splinting. Let's start. So I get a lot of calls from my viewers asking about that my front teeth, due to whatever reasons, either trauma or any sort of periodontal disease, have become loose, and I want to save those teeth because either I cannot afford implants, or I don't want to get implants, or I don't want to get a bridge treatment, or the doctor has told me that the bridge treatment will not survive because of the fact that the teeth are kind of loose. So let me explain how the concept of splinting works. For example, God forbid if you break your bone, right? What happens? You go to the orthopedic surgeon and then they reduce the fracture, and then finally they put a cast or a splint there. It's as simple as that. Splinting helps in immobilization of the teeth to promote healing till the time we take the next step to make sure that the teeth are undergoing whatever procedure. So what are the indications of periodontal splinting? I'll be very honest, a lot of times it's not just periodontal splinting. You have a lot of cases such as trauma, where you have avulsed teeth, where you have teeth which have become mobile due to injury, or the fact that you have extruded teeth that you don't want them to extrude beyond this certain point because of the absence of the antagonist tooth. So what are the indications of splinting? Very simple. First indication is periodontal disease. If the bone support has been lost due to periodontal disease or gum disease, and the teeth have become mobile before you even want to go for surgery, or you feel that the teeth can be salvaged without extracting them and increasing their lifespan because of the fact that you can save those teeth by promoting healing either through non-surgical therapy or surgical therapy, to prolong that time period, you need to make sure that you need to do periodontal splinting. The second indication may be trauma. If you've had a jaw fracture, or if you've had any sort of an injury to these teeth, where one or two teeth have become avulsed and have become mobile, so you want to keep all of them together and make sure that the healing takes place till you do the surgery for reduction. The third indication might be any sort of extruded teeth due to whatever reasons, and you don't want that tooth to get out of occlusion, that means the plane where the teeth meet, and you want to make sure that the teeth is anchored into one position. The fourth and final indication for splinting is very simple: orthodontic treatment. Post orthodontic treatment, you don't want the teeth to go back into relapse into their previous positions or something less than that, to create a cosmetically concerning problem, and that's why you do orthodontic splinting, to make sure that the teeth are retained in the position that they have been transferred to after the orthodontic treatment. Now, the kind of splints that you can have either wire splints, you can have composite splints, you can have acrylic splints, you can have partial dentures, cast partial dentures, precision attachments, and the examples go on. But the most common ones are either wires and composite etch resin based splints, and cast partial dentures for whatever purpose that they may be required for. Let me give you a statutory warning that all teeth which are loose cannot be splinted, because you have to do a thorough case selection, and which teeth can be splinted are left to the discretion and the knowledge of the dentist treating you. If the tooth is so compromised that the bone loss has gone to the apex of the tooth, you don't want to splint that tooth because it's not going to work. The second thing I would want to elaborate is the number of teeth that you're trying to save or salvage or prolong their healing period. Through splinting, the number of healthy teeth around them should be double. It's a very simple rule that if you have two teeth that are there, you need two more teeth on either side to make sure that the teeth at least are, the distribution of the forces which have become traumatic for whatever reasons, due to gum disease, due to trauma from occlusion, or any sort of injury or inflammation, anything. You need to dissipate that one tooth or two teeth, or maybe probably more than that, to make sure that the forces that are traumatic, that are causing them problems, that is causing harm to the teeth and the surrounding tissues, that force gets distributed amongst healthier teeth, and that's where the healing will happen. So what you have to really understand is that case selection is very important, and this might not be a completely permanent solution in most cases, but it is a very good interim solution to prolong the life of the teeth that have been compromised, to avoid extraction firstly, and to make sure that periodontal healing is taking place before you do any sort of corrective procedures such as periodontal surgery, restorative procedures, or extractions for that matter. You have to make sure that everything gets healed around the tissue, so that you can go for either correcting the tooth and its surrounding tissues, or finally replacing it with a prosthesis that makes sure that whatever teeth that have been unfortunately lost have been replaced into healthy tissue. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to contact me on WhatsApp, here is my number. Kindly refrain from calling directly as I might be busy with patients. You can drop me a message with your name, location and your chief complaint, and these are my social media handles. So make sure that you are healthy, and at the same time, if you feel that there is some feedback, constructive feedback, criticism, queries, apprehensions, doubts or questions, please feel free to do so in the YouTube comment section. Thank you.